Hello everyone, welcome back to part 3 of our series on the muscles of the lower limb. In this series, we are studying the muscles of the hip and thigh region. Today, we will discuss the deep gluteal muscles. The deep gluteal muscle group consists of five main muscles: piriformis, obturator internus, superior gemellus, inferior gemellus, and quadratus femoris. In this previous video, I explained the superficial gluteus muscles. So if you have not watched that video yet, I recommended you watching it first as it will help you better understand today's topic on the deep gluteal muscles. So let's get started. Let us begin with the first deep gluteal muscle, the piriformis muscle. Its origin, the pelvis surface of the sacrum, the gluteal surface of the ilium, and insertion, it inserts into the superior border of the greater trochanter of the femur. Nerve supply, the piriformis muscle supplied by the nerve to piriformis arising from the sacral plexus S1 to S2, and blood supply is provided by the superior gluteal artery and inferior gluteal artery. Next, function. The piriformis muscle performs so many functions, that is lateral rotation of the thigh at the hip joint, abduction of the thigh when the hip is flexed, stabilization of the head of the femur within the acetabulum. I'll give some daily life examples. External rotation of the thigh occurs when you turn your foot outward while standing and all. Then abduction of the thigh occurs when you move your legs sideways, such as while getting out of a car or stepping to the side. And stabilization of the hip joint is important during walking, running, climbing stairs, and standing on one leg. Therefore, the piriformis muscle helps maintain balance and stability during many everyday activities. The piriformis muscle is an important landmark in the gluteal region because several structures pass through the greater sciatica foramen below it. The useful mnemonic is the pins. P stands for posterior cutaneous nerve of the thigh. I stands for inferior gluteal vessels. N stands for nerve to quadratus femoris. P stands for pudendal nerve. I stands for internal pudendal vessels, N stands for nerve to obturator internus, and S stands for sciatic nerve. Remember, everything this mnemonic will help you recall the structures passing inferior to the piriformis muscles. Okay. Second muscle, obturator internus. Origin, the obturator internus originates from the pelvic surface of the obturator membrane and the surrounding margins of the obturator foramen. Okay. Insertion, it inserts into the medial surface of the greater trochanter of the femur. Remember greater trochanter of the femur for this muscle group. Okay. Nerve supply, the obturator internus is supplied by the nerve to obturator internus arising from the sacral plexus L5 to S1. Blood supply is mainly provided by the obturator artery with contribution from the superior and inferior gluteal arteries. Functions, lateral rotation of the extended thigh, uh, abduct, abduction of the thigh when the hip is flexed, stabilization of the hip joint by holding the head of the femur within the acetabulum. So, daily life examples, if you see, external rotation occurs when you turn your foot outward while standing and all. And abduction of the flexed thigh occurs when you sit and move your knee outward. And obturator internus and piriformis plays a similar role in the function activity. Okay. Third muscle is superior gemellus muscle. Its origin, the superior gemellus originates from the ischial spine of the hip bone, and insertion, it inserts into the medial surface of greater trochanter of the femur along with tendon of the obturator internus. Okay. So remember greater trochanter of the femur for this deep muscle group. Okay. And nerve supply, the superior gemellus is supplied by nerve to obturator internus arising from sacral plexus L5 to S1, and blood supply is provided mainly by the superior artery and inferior gluteal artery. Functions, again same, lateral rotation of the thigh at the hip joint, abduction of the thigh when the hip is flexed, and stabilization of the head of the femur within the acetabulum. So daily life examples is same as obturator internus, same. Okay. External rotation occurs when you turn your foot outward while standing. Abduction of the thigh occurs when you move your knee outward while sitting. And stabilization of the hip while doing your daily activities like walking, running, climbing stairs, and all. So they play similar role. Okay. Fourth muscle is inferior gemellus muscle. So superior gemellus muscle and inferior gemellus muscle. So easy to remember. And origin, the inferior gemellus originates from the ischial tuberosity, and insertion, it insert into the medial surface of the greater trochanter of the femur again. Okay. And now supply, the inferior gemellus is supplied by the nerve to quadratus femoris arising from the sacral plexus L5 to S1. Okay. And blood supply is mainly provided by the again same superior gluteal artery and inferior gluteal artery, and function is also same, that is lateral rotation of the thigh at the hip joint, abduction of the thigh when the hip is flexed, stabilization of the head of the femur within the acetabulum. So daily life examples is also same, helps turn the leg outward while standing, assist in moving some knee outward when sitting, and helps to maintain hip stability during our daily activities. The fifth and final deep muscle, the quadratus femoris muscle. Its origin, ischial tuberosity, and this muscle is in a square shape. Okay, so it is easy to identify. And insertion is intertrochanteric crest of the femur. And nerve supply, the quadratus femoris is supplied by the nerve to quadratus femoris. So arising from the sacral plexus, that is L4 to S1, and blood supply is mainly provided by the same inferior gluteal artery and superior gluteal artery. So function is also same, like a lateral rotation of the thigh at the hip joint, stabilization of the head of the femur within the scapula. Daily life examples same, helps turn the leg outward while standing or walking, and assist in changing direction while walking or running, and helps stabilization of the hip joint during any daily activities. Now let us move on to the most important part of my video, the note point. These points will help you remember the deep gluteal muscles more easily, okay? So first one is insertion point. Piriformis, obturator interna, superior gemellus, inferior gemellus muscles. These all are inserted in one point, that is greater trochanter of the femur. But quadratus femoris is the exception, that is only inserted into intertrochanteric crest of the femur. Okay, remember this one. And common functions, all five deep gluteal muscles functions are same, that is laterally rotate the thigh at the hip joint, helps to stabilize the head of the femur within the acetabulum, and thereby stabilization of the hip joint is happens. And nerve supply, all these muscles receive the nerve supply from branches of the sacral plexus. And blood supply, most of these muscles receives blood from the superior and inferior gluteal arteries. Okay, if you remember these 4 points, studying the gluteal muscles, that is deep gluteal muscles, becomes much easier. So this point, note point, is designed to help you revise the topic quickly before exams and remember the important concepts, right? So that's all for today's video on the deep gluteal muscles. In the next video, we will continue with part 4 of our lower limb muscle series. Thank you so much for watching. If you found this video helpful, please like, share and subscribe to the channel. If you have any questions or doubts regarding to this topic, feel free to leave them in the comment section below. I'll be happy to help. Thank you. See you in the next video.